Everyone, we've had a delay in the participants. Dr. Zink and Dr. McLaughlin are tied up in a meeting until about 4:30. So we're going to delay things 30 minutes until they can join us, if that's all right with you.
Sounds good. I love your tie, Mr. Carey.
I didn't want to be too informal, so I decided I needed this.
There's a global pandemic right now. You do you, man. You can be casual if you want.
I understand. 30 minutes it is. Thank you.
Okay.
Shelley, can we do a screen share? We could type out a note and maybe even leave the Zoom open and put up a note that says that we'll resume at 4:30. That might help people who are calling in.
Absolutely. Do you want to put the screen share up? Can you take it from where you're at?
Let me try and see if I can do that. Hold on one second. Thanks.
Good afternoon. This will be a work session of the Soldotna City Council to receive a briefing on the status of COVID-19 in the state of Alaska and within the Soldotna area. This work session is open to the public via Zoom, but no public testimony will be taken, and questions and discussions will be between the presenters, the City Council, and the City Manager. I would like to introduce the presenters and thank them for taking time out for their busy schedule to meet with us today. I'm not sure all of them are on here, but Dr. Ann Zink, State of Alaska Chief Medical Officer, Dr. Joe McLaughlin, State Epidemiologist, and Dr. Coleman Cutchins, State Testing Coordinator. I am Paul Whitney, Mayor of Soldotna, and present from the City Council are Vice Mayor Lisa Parker and Council members Pamela Parker, Jordan Chilson, David Carey, and Justin Ruffridge. City Manager Stephanie Queen will also be participating in this work session. I would like to start by having City Manager Queen make a brief presentation on what we as a city are doing to mitigate the spread of COVID-19. We will then move on to Dr. Zink and the other presenters for a briefing, then questions and discussions. Ms. Queen?
Thank you, Mayor Whitney. I will give a little bit of update. I want to be really respectful of all of our presenters' time, and I want to thank them for making themselves available to speak to the council and to the broader community. If there are folks who are joining us that are going to be either presenting or assisting with that presentation, can you digitally raise your hand? That'll make it easier for our clerk to see you in the attendee list and promote you to a panelist. So as folks are able to join us, if we don't see you in the list, go ahead and raise your hand if you're one of those presenters. Dr. Zink just joined on, so we'll go ahead and promote her. Just very briefly, we at the city have been very focused on all of our own facilities and trying to ensure that we're adopting new protocols and operating procedures to keep our city facilities safe. These are recreational facilities and cultural ones like the library, as well as essential services. And I think the genesis of this public work session was to look more outward at community mitigation, recognizing what's going on in the community and the rise in cases, which has been concerning to some, as well as conversations recently with our healthcare providers locally about the capacity, as well as their impact of just having staff that are exposed to community spread like the rest of us are. So really, thank you again for taking the time. I'm going to hand it over to you, Dr. Zink. Thank you for joining us, and go ahead and present any information you think that would be good for us to hear.
Great. I so apologize that I wasn't able to come on earlier. It's as it's escalating, so are the meetings across the state overall, but really appreciate the time and effort that you guys took to come together today. Yeah, so unfortunately, we really are on an escalation. So we're seeing an increased number of cases. And unfortunately, those are also resulting in increasing hospitalizations as well as deaths. Unfortunately, today we had our 100th Alaskan who's passed away today from COVID-19. So happy to answer kind of any questions. We do know a lot more about COVID than we did, 2 months ago, 6 months ago, 8 months ago. And I always say I'd rather sick COVID now than I would 6 months ago, but I'd rather it 6 months from now than today, just without how much we've learned. In general, the things that we've learned is that if you get it, some people are totally fine. CDC estimates that approximately 40% of people are completely asymptomatic. And that's great that people have very little symptoms. We do think that then a vast majority of people have fairly mild symptoms. So they develop a fever, runny nose, cough. It's amazing how many people say they just thought this was their allergies or something mild. But unfortunately, it can really impact people of all ages. The more underlying health factors someone has and the older they are, the higher risk that they are. If you're between the ages of 1 and 15, you're more likely to die for influenza. But if you're over 15, you're more likely to die from COVID. And that increases with every year of age. Unfortunately, it's not just a small group of us that are at high risk for COVID. So if you look at just underlying health factors, 67% of Alaskans have one or more of the 6 major high risk factors for COVID. So that's not small. And if you add on top of that age, we get up to 71% of Alaskans have a high risk factor for COVID. And we know the more risk factors you have and the older you are, the higher chance of both hospitalization and death. That just means higher chances. That doesn't mean you will. And so I think that there's been way too much a dichotomy in this disease. I think it's too much like these young people are going to be fine and these old people are all going to die. And that's definitely not the case. We see older people who get sick and some older people who have very few symptoms and some who just do totally fine. And the same with younger people. So, we've had someone in their 20s, someone in their 30s pass away in the state of Alaska. We have some kids who are currently hospitalized with COVID complications right now. So it's not that it is nothing. It can happen at age. And the other thing we don't understand fully is the long-term implications of COVID. So we're seeing more and more cases of what we call long COVID. People have higher risk for clotting disorders, other lung and heart function problems, increased risk of mental illness later. So like most things, prevention is our best tool. Not only is it our best tool to prevent hospitals being overwhelmed, but it's our best tool to keeping people healthy. And that keeps our healthcare costs down, that keeps people healthy and active, that keeps people employed, that keeps businesses open. The tools that we have from public health are really tools for you all. They're tools for individuals, they're tools for communities, and they're tools for businesses to stay open, to stay healthy, and to moving forward. And the enemy really here is the virus and not each other. And so our job in DHSS is to provide you with as many tools as we know how to, and in many different ways as possible, so that you can make the hard decisions as individuals, as business owners, as policymakers on what that looks like in your community and how to share those overall. I think the other thing that I just wanted to touch on is the timeline. And so we've been at this for a really long time, and it feels overwhelming, and it's been hard for so many and in so many different ways. We just had a meeting with our public health team. We had over 400 people, and everyone's has different experiences. Some have lost family and friends. Some have been incredibly isolated. Some have their kids climbing all over them because they're not in school. Some have lost jobs, and those are hard things. Everyone has a really hard story about COVID in so many different ways. And I think that risk and that balance of the tools that we use has to be thought about. We are human creatures, and I think the thing that I hate the most about COVID is that it takes advantage of our connection. It takes advantage of the most innate parts of who we are as human. I mean, man, I miss hugging my friends. I miss my parents. I haven't seen them. My kids haven't. Those things are hard, and the longer it goes on, the harder it is. And so I think there's been a lot of hardness. But there's also tremendous hope, and I think I get to be a front line of that hope, and I don't think other people get to see it in the same sort of way. And that's seeing the scientific community come together to learn and respond to this disease. And I know that from a public standing point, it feels like it's all over the place and there's all this data and everyone changes their mind and no one can keep up. But the reality is there's been a lot more consensus and a ton of teamwork that's been happening in the medical community. It's just been over 1 year that this virus was first diagnosed. We're just on our year anniversary of the first kind of cases that were reported in China. We haven't had it in the US in a year. By early January, it had been genetically sequenced so we could see exactly what it was made up with. That was shared publicly, and the whole world took off on trying to find solutions. We have such a better understanding of this disease now than we did before, and we have treatment options like we didn't before. We're so much better able to care for patients in the emergency department in the hospital than we were before. But the biggest thing is we have 2 vaccines that are looking incredibly promising. And I honestly think they'll be here within a couple of weeks. We expect that one of them will be submitting to the FDA for EUA approval by the end of this week. They have told us their timeline is they want to look through the data in 2 weeks and then get it out to states within 24 hours. There can always be hiccups, and I'm betting on hiccups and hangups within that. Anything moving, so much going on can, and so I don't want to overpromise. But it not only has it shown to be incredibly effective, between 94 to 96% effective in its ability, but we were looking at the Pfizer and the Moderna vaccine. They didn't see any severe illness in the patients who got vaccine. So even the patients who get it didn't get severely ill. They saw that in all age groups. So the older we get, the worse our immune system responds to vaccines. And that was one of the big concerns with these vaccines is, would this work for older people? but it's looking like the diverse group of people that they enrolled, both older and younger, as well as a whole series of different ethnic and racial minorities, are responding very well to the vaccine, and it's becoming very efficacious. So it's super exciting to see that. It's going to be limited at first. It's kind of like a faucet slowly turning on, or I kind of think of it like the sun. We don't notice that December 22nd is longer than December 21st, but we all inherently know living here that it does get lighter and it does get better. And I think that COVID is going to be a lot like the sun in this state. I think that it's going to slowly get better. Slowly, we're going to have vaccine in December. It's not going to be enough to notice. February can still be an icy month, but the sun's coming sooner. And by spring equinox, things are markedly, it's really, I think that's when we'll be really picking up with vaccine distribution. And I think by summer solstice, we'll be having a very different time. So while we're asking a lot from Alaskans right now, and in so many different ways, I don't think this is going to be forever. And I think the end is getting much nearer. Fauci said, he's like, the cavalry are coming. The White House said, Vice President Trump said, the finish line is, we can see it. Don't lay down before the finish line. We are getting really, really close to some amazing treatment options. Again, I can't guarantee it, and things can always change, but they look both safe and efficacious. And that is really, really important. So in the meantime, we're trying to do everything we can to bolster our communities to stay healthy and well until we can get kind of a more rapid vaccine distribution. We know it won't stop all cases. We know that this virus primarily is spread by person to person. There's a little bit of anal transmission, but not much. It can't live on its own. It needs us to be able to replicate and move. So it's not like an earthquake that just happens to us. This is something that we choose to let spread from person to person when we choose to gather. And unfortunately, it gathers in those that we're most close to, and it's in friends and family and places that we let our guard down. And I time and time again, take care of patients in the emergency department who say, I wish I would have known it was this bad. I thought I would be fine. Everyone else I know was fine. How come it's not fine for me? And I think from the health of our communities, the more we can do for prevention, it's going to save us money. It's going to save our businesses. It's going to save our public, and it's going to help us slow things down before we get the vaccine out, which is coming shortly. So that's where we're at in the state. I do think that there's a ton of hope out there, even though we're entering a dark phase in the winter. But I really want to make sure that I'm answering your questions and provide the support that you need.
Are there any questions from the council?
Mayor Whitney.
Vice Mayor Parker, go ahead.
Yeah, thank you. Thank you, Dr. Zink, for your comments. You made a statement that you're helping bolster communities. Can you elaborate on how it is you're helping bolster communities?
Yeah, so there's a whole series of things that I can think about, and I hope I'm answering your question. If I'm not, or if there's a specific area, feel free to let me know. So we do a lot of echoes, a lot of, it's supported by UAA, and it's Zooming, essentially, a lot of Zooming with other people. We do one for municipalities, and that one's been going on for multiple months now. Niels helps to organize that one, and we share everything from the latest science and data to vaccine planning to, different communities have shared what they've done or worked. So that's one way specifically. We have 19 different echoes that have been going on, one on vaccine planning. We've got ones on healthcare providers. We do one for the public for the science echoes. We usually have about 200 to 300 people who log in and a couple thousand more who come on Facebook, and we try to answer all the questions to that. So that's just in the kind of our direct interface with communities. Some communities have asked us to kind of, talk to them about what does this look like or what does that look like. Then there's a whole bunch that we're doing to try to mitigate the disease as a whole. So we have a public information team. They're doing a ton of public information and to get things out, hospital support and making sure that hospitals have what they need. So we have a patient movement team that is looking at patient movement. Unfortunately, Bethel area became quite stressed here recently with the number of patients they had, and Anchorage was full, and so they had to transfer patients to Fairbanks, which they don't typically do. And so that was super concerning. So we've been looking at staffing, what ways we can cross-train staff between places like surgical centers and clinics into hospitals. We have alternative care sites that are set up that we've been maintaining since the spring. Testing, Coleman Cutchins is on here, our testing czar, and everything we can do to try to make sure that there's accessible and ideally fast turnaround time for testing. It continues to be a scarce resource that the whole country is struggling with as a whole, but we're continuing to move things around. Treatment options, so there's 2 treatments that are FDA approved, remdesivir as well as a monoclonal antibody. So not only making sure that hospitals have those, but making sure they have the education and support that they need and distribution, and making sure that's adequate, everything from prevention and how we work with our chronic. I feel like an entire public health section has been kind of removed and changed around to try to do that with everything we can to help communities to be able to respond to this and to do everything we can to keep people healthy and well. We've brought in new people. We've completely revamped other systems. Our experience in the state of Alaska, I would say, is quite different than many other states in many ways. Most other states have relied a lot more on the commercial market to be able to respond. We didn't have any commercial lab testing until about a week and a half ago. And so all of our testing had to be set up essentially via us. And so we could send some stuff out of the lower 48. So we had to completely revamp like the state public health lab to be able to respond to this. So other states have had, either they have bigger universities or they have a lot larger commercial market to help respond, both from a information sharing as well as, testing and other resources. So that's a brief overview, but I've gone for a long time about that one. I appreciate you asking. Is there an area specific that I might have missed or?
Just a follow-up, and I am familiar with what UAA and UAF have done to help in this process, and it's been tremendous. Have you guys looked at what other states are doing and what other governors are doing as they too are seeing the same surge that we are seeing in Alaska? My son lives in Kentucky, and the governor today there again put the restaurants into takeout only unless they have outside dining facilities. So are you looking what governors are doing in other states and making recommendations to our governor?
Yeah, I appreciate that question. 100%. So I'm what's called a state health official. There's one from every state. We meet at least once a week. Oftentimes it's more like 3 to 4 times a week with just state health officials. And then almost at every layer within public health, or many of the layers, there's similar sorts of groups. So the epidemiologists all get together, the vaccine planners all get together. And that is kind of in their big national groups. And then we have breakout groups within that. So we're in Division 10 for HHS. I meet with them at 6:30 every Friday morning with the other ones and kind of hear what all's going on and talk with them. There is breakout groups on all sorts of topics that we end up doing, be it IT, information sharing, mitigation strategies. We have email exchanges back and forth. We see what's in the news, but then also there's a lot of back and forth in sharing. And, when I took this job, my professional motto has always been to do what's right for the patients and remember that the rest is noise. And that's helpful to me in the emergency department, as to remember that, at the end of the day, I got to do what's right for my patients. And that has been my motto in this position as well. And so what I share with you all here or on the Public Science Echo or with the governor or with mayors is the same stuff. So I'm me, no matter where you get me. It's just much easier to be me than to worry about who I'm talking to or where and when. And so I'm consistent with that. And so what I share and learn from those experiences, I share and learn at every chance I have, if I think it will help promote the health and well-being of Alaskans.
Mr. Chilson?
Thank you, Mr. Mayor. So once we're at a point where we have vaccine options that have been approved for public use, it seems pretty clear that the initial supply is going to be limited and needing to be targeted towards key strategic areas. But as production ramps up and the available supply pool grows, what role would you see local municipalities playing in the distribution of that and getting it out to the public? Or would you see the state more strongly directly administering that?
Local is absolutely critical for being able to administer a vaccine. And so we have been already meeting with the local EOCs on a very regular basis. You're exactly right that I think it will be quite limited. Even if they said like all frontline healthcare workers or long-term care facility, what we're hearing for vaccine numbers, we wouldn't even be able to meet our 1A or our 1AA group, even with the first administration. So I think it's going to take a while for that to kind of get all the way out. But we're working with local administration through the normal vaccine process as well as additional vaccine planning to make sure that we get it out as quickly and efficiently as possible. The 2 vaccines that have currently been approved, one requires a -80 ultra cold chain storage, and the other one is kind of the normal cold chain storage, which the normal one, we have that mastered. Like that's our normal system of vaccine delivery. The ultra cold is very unique and different. And so there's going to be some huge challenges with that one. We didn't know when the timing with these vaccines would come out, but the fact that Moderna, which is the regular cold chain storage, came out right after the Pfizer, We expect them to come out at nearly the same time or maybe a week later, which honestly for Alaska is huge because then it allows us to use kind of our more normal distribution chain to get out the vaccine as quickly as possible, even though it will kind of be in limited quantities. So our public health nurses, our EOC team leads, our hospitals and our pharmacies and our FQHCs are all highly engaged in that. We're actively recruiting providers to enroll in provider enrollment so that they can help administer a vaccine. Even the hospitals may be the first line people who are administering it in that community. So this isn't really the state coming into each community and doing it. It's really looking at the local partners to be able to administer the vaccine. And I do think that there will be some local kind of, we will have our kind of advisory. We're using the national advisory recommendations on who's the 1A, and then we have an advisory team who then takes that and makes it a little bit more Alaska specific to make sure that we're getting it out. But even in that, I think that there's going to be some little bit of local variation on what makes sense in one community or another community. So we really look to the local leadership as well to help partner with us.
And I'll add to that. I actually had a call from Fairbanks yesterday about this. I really honestly think local leadership like yourselves, the best thing you can do is figure out how to get everyone in your community to get the vaccine. Vaccine is only effective if more people get it. And when we talk about it, we can have the best distribution plan, we can have the best vaccine, but that isn't going to be helpful unless people in the community want to get the vaccine and do get the vaccine. And your community way better than we do at the state. I'm sitting here in Anchorage. I love the Kenai Peninsula, but you guys know it way better than I do. So just encouraging ways of how can you get the members of your community engaged in the process and wanting to get the vaccine? Because just like the virus needs a person to transfer, the vaccine needs a person to work.
And I would also say that the governor's made it really clear there's no mandate for a vaccine, and it's actually, you can't mandate an EUA vaccine. So even private businesses cannot require a vaccine if it's under an emergency use authorization. So governor's level, no mandate, and no ability for private business to mandate it under an EUA. So I just want to make sure everyone's clear about that.
Do you have a follow-up, Mr. Cholson?
Sure. I appreciate clarifications on that. One additional clarification I would request is how is the supply on that going to be handled? If local municipalities are able to partner with community health providers to do shot clinics, because my goal would be that I'd like to see as many people coming through the doors as possible to get free vaccines, but is the state going to be appropriating those and giving them to local municipalities and health providers to do that distribution, or are we responsible for procuring those ourselves?
A fantastic question. So the initial part will be that we will be getting it and then sending it out as quickly as possible. This is what has happened with remdesivir and the monoclonal antibodies initially, as it kind of comes in and then it's distributed out. We are working with local communities, so if they can receive vaccine directly, and there's vaccine to be delivered, then it can be directly delivered to you also. It doesn't mean that it has to come through us and then back out. The Pfizer, again, has to stay at a negative 80 degrees. It depends on freezer storage. And given the size of Alaska and the number of people, we do suspect that a decent amount of that will come in, and then we will redistribute it in smaller aliquots to different communities and what that looks like. But we're really encouraging providers to sign up to be provider agreement now to be able to provide vaccine themselves. We're also working with pharmacies for pharmacy agreements because we see pharmacists as a key workhorse in getting a lot of vaccine out. And so just as Coleman mentioned, making sure the public is educated about the vaccine, tunes into your Science Echoes, ask questions. We really appreciate good, hard questions, like throw them at us, like let us know. We want Alaskans to have the data and science to make decisions for themselves, but then also encouraging providers to sign up so that it can be quickly distributed with as many hands is going to make easy work.
Okay, thank you.
Thanks.
Are there any other further, Mr. Ruffridge?
Thank you, Mr. Mayor, and thank you, Dr. Zink, and appreciate your time this evening. I guess my question would be more from a state level perspective, just because you see more than most of us would see on a daily basis. And I don't think you need to name the places or anything, but are there places around Alaska, knowing that we're varied and have a lot of different things going on, that you would say, man, that community seems to really be getting things right? Not that they're stopping COVID necessarily. They're probably having some spread, but the spread is mitigated to a degree that makes you feel proud of that group, so to speak, and that they really are listening and paying attention to all of the features. If you could just give me maybe a brief synopsis of if that community exists, and if so, what do they have in common? If if that exists?
Yeah, it's a fantastic and really hard question. And many different, I haven't been asked that. I've gotten asked a lot of the same questions before, but I haven't been asked that one. I think it's hard for me to pick a community. I mean, the governor will often ask me what state, which country, and what we know is this is a highly contagious disease, and it's really hard to keep it under control, right? Like you push it down and it comes back up. I mean, COVID takes advantage of the cracks between us. And so I think it's when I see communities working together to figure things out that is most like, wow, that was amazing. So, I can give you some just, quick example, like Cordova, like early on, they had like the fishing and they had like one Abbott machine to test. And so like they got samples from one place and they got staff from another, and they opened up a building underneath and they got other people to drive through. So none of them had all the parts to make it happen. But they all said, like, we as a community need to make this happen. And I've got this part and you've got this part. And they put it together. And then they were able to do testing for their whole community and all the fishermen without like any significant problem together. And they also did it in a place that was completely separate where the rest of the patients were. So people were still getting the rest of their medical care and mental health care. So they didn't see a decrease in that. So it wasn't like they shifted everything so much to COVID that they lost sense of the other aspects of the world. Like they kept moving in that space. To be able to move forward, and they put that together. So that was an early on example for me. I think one of the other things I learned from there was just the being able to message together how much, every time they put something out on messaging, it was like everyone messaged it, and that we're all in this, like the business communities in this, the health communities in this. Like this isn't about, health versus business. This isn't me versus you. This is all of us kind of working together and seeing what that looks like. And then I've just seen that replicated all throughout the state in different ways, the ways that, businesses have taken their stuff offline, and like Valdez, has COVID conscious business awards. And so they, celebrate all the businesses that are COVID conscious, and they announce them on the radio, and they share what that looks like and promotes like the role of small business in their community and to keep that open and figuring it out. Mat-Su has been like struggling through school opening. So like, we're learning a ton from the Mat-Su district right now and what that looks like. And so we're like, okay, this is what we're going to do. And, I think we're kind of figuring it out, but COVID's hard and it takes all of us. So when I see communities kind of come together and say like, this is where we want to figure it out. I think it's harder when it's big. And so I think that, Fairbanks, Anchorage, the Kenai, Mat-Su, like those are the areas that there's so many small, great stories, but there's so many people that I think it becomes a little bit harder for us, at least, to have visualization on those stories, because I think they're happening more locally versus we get more involved in the small stories. But for example, on the Kenai, a pharmacist noticed that like someone was using the wrong test to diagnose COVID and figured it out and helped to let us know and helped to kind of figure out what that looked like and helped to make things better. So, I just see impressive people on an everyday basis trying to figure this out together. And I really appreciate that.
You have a follow-up, Mr. Ruffridge?
No, thank you. I appreciate that.
Mr. Carey?
Thank you, and I want to thank the city as well as our presenters for being there. One of the worst things can be misinformation, and so I want to ask you a question to see if this misinformation is accurate. I've heard from a number of people there are, and my terminology will probably be wrong, but there's subgroups of the virus, and that the vaccine will only deal with one or two of the subgroups. And so I'm really hoping you're going to say the vaccine covers everything, but certainly one of the things being said why people don't need to is it won't be helpful in all of them. I hope I've made sense of what I'm asking, and I look forward to your response.
You're perfect. I appreciate that. I agree. I've sometimes joked that the only thing that spreads faster than this disease is either misinformation or social media. It can fly like there's no tomorrow. So you are 100% right in the fact that the vaccine we think will cover, but let me go into just slightly more detail. There are what we call different, like to every misinformation or rumor, there's some ounce of truth. And there are these different clades, slight genetic variations that we see. And you can actually track these variations to understand where it's moved and how it's moved across the country and the world. But these mutations seem to be small mutations that aren't causing a major shift in the way that the virus is acting. The biggest thing is it's not changing in how lethal it is. If you get it, the chance that you would die. It does look like it is shifting in how contagious it is. So it does look like it's more contagious than it was at the beginning. And part of the reason that it's been spreading faster. But these vaccines appear to mainly be hitting what's called the spike protein, these little it's called a coronavirus because it looks like a crown. It's got all these things sticking off. And those are the little spike proteins. And it's actually this pre-fusion complex, the spike protein. But we'll just go with the crown sticking up parts. And basically, they in some way deal with that crown sticking up part, those spike proteins on it, either giving you part of that spike protein or your body making some of those spike proteins and building the response. So at this point, we have every reason to think the vaccine would work against all the different, we call clades of this virus, all the different shifts that we would see, and we think it will work well against it.
Excellent. Thank you. Good answer.
Did you have a follow-up, Mr. Curry?
No, I don't.
Ms. Pamela Parker.
Thank you. And thank you, Dr. Zink, for being on this call today. I'll do my best not to fangirl, because I feel like you've been the true hero here when it comes to getting information out about COVID and also remaining very positive and upbeat while you're doing this. So I really do appreciate that. And it's encouraging to hear that a vaccine is on the horizon. Unfortunately, when we're talking about this timeline, though, of February for potential larger scale rollout of the vaccine, that's still a really long time, really far out. So my question and concern really is, what can our community be doing today, tomorrow, this week to help mitigate the spread? What can we do now while we're still waiting a few months for a vaccine to really be ready?
Yeah, no, I appreciate that question in so many different ways. A couple different things. I would say that first, even when vaccine comes out in small form, while you may not be vaccinated or friends you know may not be, it's still going to have a really big impact on things like the healthcare system, right? So if we have less healthcare workers who are out sick, they can have more capacity. So part of our capacity challenge right now is the fact that they're human and they also can get the virus. It's oftentimes not at work. It's oftentimes, their spouse, like, went to a soccer game or something else and then brings it home to them as well. So I think that even small bits are going to make a big difference in capacity. Two, I think that the prevention measures that we talk about really work. And I think I've grown to have a new appreciation for how they work. I know when our cases started to surge, I called my predecessor who works at the CDC now, and I was like, Dr. Butler, like, what else you got? Help me out here. I've got to help our communities. And he's like, it's the same stuff, Ann. You just got to keep doing the same stuff. And it's not sexy and it's not super cool and it's really, really hard to do. But it's that washing, wearing a mask, and distancing are huge. I also think that I'm really concerned about the mental health and resiliency of our communities. And I think that when we're exhausted and tired or broke or lonely, it's hard to wear a mask and it's hard to stay away from others. And so I think that the more we can encourage our communities to be resilient, the more that we can empower them to make those choices, the easier it is. I feel like it's kind of those basic pyramids of life, right? If you don't have food, you don't have shelter, if you don't have connection, it's really hard to add those additional layers on it. So when I see communities, put out outdoor ice skating rinks so kids can still skate instead of being indoors and spreading the virus, like when they figure out ways to be playful and outside and active and healthy and connected, but in a safe way, I think that helps us to be resilient and uses these tools on top of us. So I think the more our communities can find ways to be resilient but safe at the same time and to not take advantage of the cracks between us, I think the more we politically divide between each other, this virus just takes advantage of the cracks. It's this science paper and that science paper. I'm going to use this against that. Science is supposed to change. Science is supposed to be wrong because we got to keep challenging it. And if it doesn't stand up and hold the light, then we continue to shape and change. And, back to Dave's point, like maybe this virus will change and I'll have a different answer 6 months from now. I hope not, but maybe we will. And that's just the nature of science and life. And so I think the more that we can work together in this, I sometimes feel like when I talk to communities, the word fatalism has taken on a whole new meaning. And I think it's become literally fatal in this state. When people would just say, well, this is just what's going to happen. That's fatal. And that is what I think is literally making people sick. We control this virus and we can control its spread, but we need to empower every person in our community to play a part in that and to care for each other.
You have a follow-up, Ms. Parker?
Thank you, I do. And like you said, we've known these prevention methods from the very beginning. Wash your hands, wear a mask, stay away from folks that aren't in your bubble. Mm-hmm. But it seems like we've kind of gone away from that as a state recently with, sorry, my dinner's ready. I'm going to carry with me to the kitchen while I turn the timer off. So we've gotten away from that in the recent months, and now things are open. You can, come down to the peninsula, there's no restrictions. And that's not necessarily the messaging that I think we need to be putting out. And my concern is that there's not a unified plan or message from the state, from the borough, from the cities. Everyone's left to just figure this out on their own. And that actually ends up falling to our small businesses that then have to decide, okay, well, I'm not going to let folks in my store unless they wear masks. Well, then now my employees are getting yelled at because I've asked them to enforce our mask policy for the store. And then I think it just brings that divide between people more to the forefront when you have the maskers and the anti-maskers, where if it came down from the top that this was what the state of Alaska is doing versus, hey guys, please, please do this because we know it works. We know it's the right thing to do. Like, can you guys can you do it? Is there any plan in the future, near future, before we get this vaccine really out and rolling for a top-down approach to handling these mitigation efforts? Is that something that's on the table at all?
Well, a couple different things. I would say that, we've really kind of been talking about our response to this virus in kind of 3 phases. And so phase 1 felt like a tsunami was coming, but you had no way to see it, right? We had no testing. We didn't understand how to keep our healthcare workers safe. We didn't have PPE. We were seeing people die, 3 out of 1,000 people in New York died. We were seeing what was happening in Italy. We didn't understand how this disease affected you in so many different ways. And so we were pretty much blind at that time. I remember at one point when we got down to 6 swabs that we could find in the state to be able to test for people. And we're like at midnight calling, like checking through office drawers to see if we can get more from anywhere else. We were pretty much blind. And then we started to get some tools and resources. And it kind of felt like being in a ship and going out in the fog. And we had, a little flashlight and some radar. And we started to kind of find our way through it as we kind of entered into phase 2, which was kind of this sustain. And in that process, we've been just trying to gain and share the tools that we have in as many ways as possible. So we all remember the early part where, CDC wasn't really sure about masks and we didn't have a lot of data behind that. And I remember this big fight back and forth between us and the CDC. And I'm like, do they work or not? Like, I need to do something to protect the community. And they're like, well, let me tell you all the caveats of the data. And I'm like, I just need something, but what else can I do? Help me out here in so many different ways. So I think we've learned a ton about masks in a short period of time. We have so much more PPE than we had beforehand, surgical masks, N95s, other ways to support our healthcare workers. And so that's been really kind of phase 2. And phase 3 now, I feel like is what we've really entered into, is where we have a lot of disease spreading. We've got tools, but we need individuals to make those actions. And I hear you. I wish I had a playbook. And if I just did this, and this, I would make sure that people's lives were saved and they didn't go bankrupt and that they had jobs and that they were fine. And that was because all of those things fit together, but there's no playbook to this. And, we go off of an influenza playbook. We go off these previous ones. We're learning as fast as we can from each other. And, what works in Anchorage really doesn't always work in Utqiagvik. And so when you say to do this, it's been really eye-opening just with the schools and each of the school districts. You're like, well, you need to, be anything from separate to how you're using the bus schedule. Anchorage is like, well, that's going to be my 1,200 students and I'm going to have to do lunch with. And I'm like, oh, that's a lot more students than if I do it this way. And so it's really hard from a state perspective to say exactly what to do and to say do this. We are consistent no matter what we say, like to the government, like masks work. This is a tool to use. I would say that nothing is off the table. Like we're always having these discussions of what this looks like. But just like vaccine planning, there's some local nuances that make a huge difference in the ways that things work or don't work. And I want to make sure that we're moving forward, empowering communities to have what they need as we continue to find ways to respond better as a state. But I know that's not a perfect answer to your question. I just say nothing's off the table. We're always having these conversations. But these tools don't reside in just the federal government. They don't reside in just the state government. They don't reside in just local government. And they don't reside just in your business. And it is hard at every level of that. And there's no easy answer to that. But the more we all do this live together, I think the easier it will be. But that doesn't abdicate our responsibility as a state, which I take very seriously, to do the best we can with the tools we have.
Ms. Queen?
Thank you, Mr. Mayor. I wanted to recognize Leslie Phelps, who's from the Kenai Public Health Office as well. And my question is, do we have a sense at this point through contact tracing where exposures are occurring? Or does it even make sense to ask that question now? Because early on we were thinking large gatherings or this particular type of business versus a different type. Is there any, because we don't have access to that data here at a local municipal level, is there anything you can share? Are there places where transmissions or exposures are occurring, or is it more broad and widespread than that at this point?
Hi, Stephanie and everyone else. Thank you so much for asking that question. Now on the Kenai Peninsula, we have exponential spread. Every type of business, every type of gathering, we're seeing even smaller groups within families kind of giving COVID to each other. So there just isn't any place anymore where we can actually target mitigation, prevention methods. We all need to practice that because we may be standing in the grocery store or in a small group at a stop sign or something like that, and someone may be infected and can share it. So sorry, but thank you for asking the question.
I think to build off of that, I get that question a lot, like, well, if I could see the data. Well, the data feels like a lot of noise right now. It really is hard to separate out because there's so many cases. Dr. McLaughlin described it as popcorn. Initially it was this pop, 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 and you could hear it and you could identify it. And now it's just like popcorn everywhere, and it's really hard to know. I mean, I've seen patients in the emergency department who've had, 200 contacts over their infectious period. I have no idea where that person got it from. He went to 3 Halloween parties and went to 4 different restaurants. I think that we see consistent things, and that's when people are enclosed in indoor spaces, when they don't have a mask and they don't distance. Like that consistently is places that we see it. Initially, that was a lot of businesses, but I think businesses have started to mitigate this in a lot better ways and a lot of different ways. And so now we're seeing it in other places, particularly, the friend groups or the places you let things down. So like for the healthcare world, we initially saw a patient to provider transfer, but now we see very little of that, and we see it in the break rooms or when they socialize afterwards. It's when they think they're okay and they let down their mask and they let down their guard. The other thing that I would just say is like when it's raining hard, you figure out if your roof's leaking. And right now it's raining really hard in Alaska. And so an interaction that might have been safe this summer may not be safe now because we've got so much COVID spreading. And I think that translation totally hasn't caught up with people. They're like, well, I did soccer fine all summer. I don't understand why I got sick doing hockey. And you can, talk about indoor spaces, but it's much more than that. It's just the chance of getting things right now when it's spreading. If we don't have COVID spreading, it's not hard. It's, you don't get it. And that's what we really saw for the first couple of weeks, after things opened up in the beginning of May. We just saw, like, I was kind of waiting for it to grow, but like we had no COVID spreading. So we just didn't have any increase in cases, but it just builds up and builds up in the community. And once it starts to build up to a boiling point, it just goes. And then once it starts this exponential spread, it takes more and more and more effort to get it down. So you can't just use your mitigation that you use this summer. You have to do more cases. You have to bring it down. And I think that we as humans understand linear spread. We don't intuitively understand exponential spread. And we have exponential spread right now. And so we have to exponentially do more work to be able to pull back on it.
A follow-up, Ms. Queen?
No,
Mr.
thank you.
Carey? Mr. Carey?
Thank you. It's so distressing to hear the exhaustion of the healthcare providers, and it's so far past exhaustion, as well as certainly the casualties. Is there any role for those individuals who have had they've had the virus and obviously have survived it? Is there anything that we can be doing, or is there some way we can help?
Well, thank you for that. I think we can all help in many different ways. I definitely think this takes all of us, and be it that helping to share, information and clear up disinformation. I think people who've gotten it can donate plasma, particularly right after they got sick. And so that's the kind of biggest thing. So people's plasma, we pull off the antibodies and kind of clean out the blood. And that is a treatment option of a series of treatment options. It's best if that donation happens quickly after someone has cleared their infection, because that's kind of when you have those antibodies spreading. Unfortunately, we do see reinfection. And so for the first 90 days after exposure, we say, okay, you don't need to get regular, like if you're traveling, you don't have to have a travel screening test. If you're doing a pre-procedural, you don't have to have a pre-procedural test for those 90 days, because we think that you've got a decent immunity as long as you're feeling well. If you get sick, we have seen some reinfection in those 90 days. But unfortunately, at 90 days, everyone goes back from a calculation standpoint to ground zero because we see reinfection. And so, and so, we've had healthcare workers already who've had it twice, and they were like, man, we were counting on this healthcare worker to be our workhorse for this, to be the one that would be immune. Unfortunately, we see a lot of variability in people's immune response to this, and we don't see it last super long. Some people it lasts a while, but not others. And we see better immune response from the vaccine than infection itself.
Thank you. I sure didn't like your answer.
Sorry, I got one good one for you and one bad one. I'll try maybe the third, I'll get better.
Right, I have a couple of questions here. On the vaccine, I know I've read that it's a two-shot process, and that one of those two vaccines is not good for children.
So it's a great question. So both of the ones that are out currently are probably going to come out first. I guess they're not out, but in my mind they're out because we're planning closely, are both two-shot. One's 21 days and one's 28 days apart. So depending on which vaccine it is. So it's going to be very important that if someone gets the first dose, they follow up and get that second dose. And they got to do it from the same company, and ideally it's the same lot. So this is going to take a lot of coordination. So that's why we really want to make sure people are aware and are planning. They don't make other plans for that Saturday and they get their repeat vaccine. The second thing is we know kids are not as affected as adults by it. And so the studies did not enroll children early on in this virus. So it doesn't mean the vaccine won't work for them. It was just not who they prioritized for studying the vaccine for. They really prioritized it for people initially over 18. And Coleman, do you know if I think the Moderna went down to 15. Do you remember?
I think they're both 18. The important thing to remember is children and pregnant women are considered vulnerable populations. So to authorize a drug in either of those populations, it has to be studied in those populations. Mm-hmm. So, it's not the fact that it won't work in kids, it just wasn't studied in kids. So, and the primary reason it wasn't studied in kids is exactly like Dr. Zink said, they didn't have as high of a risk. If it had been the other way around, there's other vaccines that we study in kids first, but in this instance, it was adults. So my guess is it's probably going to be 6 months to a year until we see an approval for pediatric use under 18.
Follow up on that. One of the questions that have come up here recently is the mental health aspect of this. Mm-hmm. And we're starting to see it around here, or at least from conversations I've had, is with the young adults, the teenagers and the high school kids. What can we do on that? How can we help that?
Yeah, I really appreciate your question. I have a middle schooler and a high schooler, so I live those days, some days. Couple different things. From a data perspective, we've looked at suicides, we've looked at overdoses, and we've looked at ER presentations for mental health illness. And in the state of Alaska, we've been fortunate that none of those are above kind of what we see year to year at this point. So that's what we're seeing from the data. The stories we're hearing are very much like what you're sharing, that there's a lot of struggling going on and things aren't going well. We see a little bit of that in our call line, and that is that we've had an increase in new callers to our suicide call line. And so it's interesting, some of our kind of more frequent callers aren't calling as much, but people who this is really new and super stressful are calling more. So we have a bunch of new callers to that. The thing I think about the youth, and when I talk to, like on these youth podcasts and other things about young adults, this is going to define their generation. People will remember a war or 9/11. They're going to remember COVID. This is going to define their generation. And I think that the more that we empower them to have agency over that, the more it's not something that happens to them, but something that they get to be a part of the solution. And I think the more that we frame it in a frame of resiliency, the better off we can empower them. So like with my kids this year, when I knew they weren't going to be going back to school, I said, write down a list of the things that you want, ways you're going to be resilient. And what are you going to learn that's totally new and different this year? Because this is just a different year. This is just your COVID year. Don't think about I missed out on X, Y, or Z, whatever, because you are, because that's what's going to happen. But in this year, you're going to learn resiliency. And I want you to take agency over your year this year. And our young, they're healthy, and they're the ones who are least impacted by this. So can we have them bringing food to our senior centers? Can we be, having them help with the vaccine distribution? Can they be doing social media? Can they be helping with the misinformation? We have so much work to do, and they are young and excited and healthy. Let's give them agency over this pandemic and put them to work. Let's get them, shoveling off the lakes to be able and skating, rinks. Let's have them come up with creative solutions. But I think that is how we can help. We do have an entire mental health task force that's been working with COVID since the beginning. We've looked at regulation changes. We've tried to make telehealth as available as possible. We've tried to work every angle we possibly can to try to make sure that they have the support that they can if those other things aren't working as well. We're always open to suggestions and happy to send people additional resources. We have a youth group that's working on it. We have mental health for providers. We've, from the beginning, felt like this is going to be a huge issue and continue to lead into the space. But like communication, it never feels like enough, and always open to new ideas and suggestions.
Thank you.
I actually looked up the trials. Moderna only looked at 18 and up. It looks like Pfizer vaccine was actually studied in those 12 and up, but I don't know that they met their population yet for those 12 to 18. So that's actually promising that there's a possibility we'll get vaccines sooner for those 12 to 17-year-olds, but don't know when.
Another question on vaccine. When it's distributed to the states, is it going to be one manufacturer to each state, or are we going to be seeing both vaccines coming here?
I think we're going to see more than two. So I think at the beginning, we're going to see these first two, and then I think that we're going to see a series of vaccines after that. So there's a bunch of other vaccines that are being studied, including ones that don't require any refrigeration and that are single dose. And what we're hearing from the federal government is they're probably going to just be distributing what they call a pro rata basis, which is just basically per your population, and they'll be sending that out kind of equally across vaccine. There's always a chance they'll do something differently. They are vaccinating the military differently, so that's a population that we are not responsible for helping to vaccinate. So the military will be done directly for the federal relationships. The tribes had a choice to go with the state or go through IHS. We don't have full visibility on who chose what, but for the most part, they've been choosing to go with us. And actually at every level of our vaccine distribution plan, we are partnered with ANTHC. Like testing, even though our Alaska Native population is 15% of the population, 50% of our test sites are delivered at some Native site just because of the large geographic distribution. And so we expect the same with vaccines. So that's why we partnered with them early on to partner and to get it out as quickly as possible across the state.
And then aging myself here, I remember in 1975, I believe, or 76, when the swine flu vaccine, there were mile-long lines in Anchorage to get that. And fortunately, if it was at least warm out at that time. So are we going to see something like that, or is it going to be a more controlled distribution?
Our goal is a more controlled distribution for sure. And so we're trying to use the tools that we have. So there is a couple planning tools that have been worked out with the CDC for things like registering for your time. So, if you're part of this group, you can register for your time and it would be here, and it's how it would happen. I also think because we're expecting kind of limited dose, it's going to be like 6 months of vaccination. It's not going to be like, here's the states, now it's your job to get it all out. It's going to be, here's this little bit and here's a little bit more. I think this is going to be a workforce that's going to be busy for 6 months, just vaccinating every single day for months at a time, which will limit the long lines standing up. It will make it a little bit harder, and then we've got to work with that 2-dose versus the 1-dose distribution as a whole. But I would expect it to be very, very, very small at first. I mean, like some estimates is that we would get like 6,000 doses as our first one for the entire state of Alaska. Some are 11,000, some are 26,000. We don't even know how many we'd get of each one, but they're small numbers. When you think we've got about 60,000 healthcare workers and they talk about 6,000 doses, like that's a really, really small number to start with. But we'll take whatever we can get, and we'll start as soon as we can. As long as the data and science supports that it's two things, safe and efficacious, then we want to make sure Alaskans have access to it.
Thank you. Are there any further questions for Dr. Zink? Mr. Ruffridge.
Thank you, Mr. Mayor. This is probably for Dr. Zink and maybe Dr. Cutchins as well. Just in regards to testing, something maybe we haven't exactly spoken a huge amount about this evening. In the space where we're seeing exponential growth and the popcorn is getting overwhelming, as we were hearing Leslie talk about, is there a potential to test our way, out of that and prevent lockdowns? Or because in essence, my thought process on that is testing and quarantining is sort of like mini lockdowns. You lock down the people with the COVID for a period of time, and then everything else can sort of function as usual with your mitigation factors in place. What does really high level testing look like? Who's doing that well? What are their plans maybe for performing that? How do municipalities participate in that event? And just a general kind of overview of, can we test our way out of the situation we're in currently? potentially?
Go ahead,
I
Coleman.
can start with that. So, I will add that, testing is our monitoring. It's our surveillance. Dr. Zink has always used the analogy. It's our flashlight. It's what we can see. But then I'll add that, Dr. Joe McLaughlin has said since the beginning, we're not going to test our way out of COVID. I constantly remind people that, I'm not picking on anyone here, but, they were testing every person every day in the White House and they still had an outbreak. So testing alone is not going to do it. It's testing with isolation, with quarantine, with community risk mitigation strategies. It's a piece of it. It's the foundation that we need for surveillance. In terms of testing, the communities that have done really well with testing have partnered and diversified, and everyone sort of worked together. I think specifically to Anchorage, Anchorage was kind of in this place where it was very difficult to get tested. Nobody really took ownership of it. It was sort of everyone was kind of doing this and pointing the fingers at everyone else all the time. The Muni put out a contract. They got a contractor in place. Ever since, we have pretty good access to testing here in Anchorage. Fairbanks kind of did the same thing. It was, that's why we took a trip up there to get them figured out for testing. And it wasn't really until the community took ownership and that other partners got involved and people worked together, the testing got real good. I think at this point, communities need to really encourage everyone to get tested if you have any symptom that could be COVID. I think one of the best community messaging things we can do is if you have any symptom, which means it could be my seasonal allergies, but it could be COVID, encouraging everyone to get tested at the first sign and symptom. But then also understanding there's some limitations of testing as well. We keep hearing over and over again, like, why can't I get a rapid test? Rapid tests are great. Everyone wants a rapid test, but rapid tests, their biggest limitation is their low volume. Most of the devices, you can only test one person at a time. You can only test about 3 an hour. It's not a good tool in cities and in our urban areas, and it's really a scarce resource. And then also just understanding the fact that when you are a close contact and you have had a known exposure, there's no way to test your way out of that. It's quarantine, regardless of if you get a negative test every day. And also just the understanding that, we keep getting reports of somebody who gets exposed today and they go and get tested tomorrow. If I get exposed today and I go and get tested tomorrow, it is unbelievably unlikely that I will test positive. There's increasing data that it really, for people with no symptoms at all, it takes 5, 7, 10, up to 14 days for you to test positive because the virus has to replicate enough in your nose to flag that positive result. Hope that answers the question. I don't know if you have anything else to add, Dr. Singh.
Yeah, I would totally echo that. A test is a really helpful clinical tool, but we can't test our way out of it. When you ask who's done it well, people call us all the time. We're still the second most tested state in the nation. Even this is fact, we don't have any sort of commercial testing availability until like a week ago. So we test a lot more. I talked to my colleagues in the lower 48. They're struggling to test any admitted patients. And so the idea of pre-procedural testing, any of that is still really limited. The more cases you have, the more you need to test. So, we're testing almost 30,000 tests a week right now, but it's not enough. Our percent positivity is going up and up and up. And unfortunately, so is the rest of the United States. So 98% of the jurisdictions are on the upward trajectory, 2 are flat, no on the downhill. And so that's making all of the testing more limited. And so there isn't a good way to get it out super fast, and it's becoming more and more limited, just like the rest, like nurses and everything else are becoming more limited. So I wish that there was a better way to do it. We're always looking for better ways to do it. In fact, we were one of 3 states to try a new test option that is now just came in, and we're kind of getting out. Again, it's a really limited and have to back up to a different type of test. I also think that tests, I describe them as like skis, and you got to use the right test for the right thing. And so I think in some ways our access to testing, it's been an advantage, but in some ways I think it's been a disadvantage in the state because I think people have become very comfortable with getting a test and they've over-relied on the test and said, I'm negative. I remember seeing someone early on in the pandemic, they said they were negative, so they were huggable. I was like, that is not how you should interpret that test. Like, you still may be shedding virus, there's still a chance it's a false negative. And that's how we're really seeing it get into our rural communities, is they test like at the airport testing and they're like, I'm good to go. And then they go hang out with a bunch of people. Or as Coleman mentioned, they have some exposure, they get tested the next day afterwards, they feel totally fine, they go hang out with a bunch of people and they're just growing virus and spreading it. And you are most contagious right before you develop symptoms and at the very beginning of symptoms. And so that's what's really different from this disease versus other diseases, is how infectious you are early on. And then just to stem off one other piece of misinformation, I get all this time, like you guys are using the wrong tests and PCR tests have the wrong CT value and you're just testing all this dead virus. We have lots of stuff up on our website. Our goal is to identify people who can infect others. That is the goal. And so we are trying everything we can to, if you get a positive test, we tell you to go on that positive test. Don't get 20 more tests afterwards because there are limitations to each of these tests. Overall, when we've looked at our quote CT values, these cycle threshold values in our lab, the vast majority are really in this very low range, meaning the patient was highly infectious. So every quality control that we do, the tests that we're picking up mostly are picking up people who are actively infectious with the virus as a whole. And I could nerd out on that for a long time, but that would be the short answer to that.
And to add to that, the other thing I will mention is, the window that people test positive is hugely variable. You have some people who are symptomatic and they're infected and they have like a 1 or 2 day window where they could test positive. And then we've seen other people that can test positive for months. So, I think it's that thing where, a lot of people's knee-jerk reaction as soon as they test positive is, it's not real, I'm going to go get another test. And we hear those reports of somebody who tests again a few days later and it's negative, and then they think, well, I shouldn't believe the first one because it was positive, but that's not the case. All of these tests, any molecular tests and even antigen tests have almost approaching 0 false positives. Really with almost all the tests, a positive is a positive. I just wanted to add that too.
Just a follow-up to that on testing, and this would maybe be for Leslie, I guess, as well. The messaging about testing and then what follows after your test maybe seems to be a barrier, at least in our community, that people aren't quite certain or maybe just unwilling to follow along with quarantine, or I'm a close contact, what should I do? In fact, just before this meeting started, I was fielding some text messages from some individuals who, same thing that we were just hearing about. I have COVID. This person that's with me wants to go to work tomorrow. What should I do? Can I get a test? And that ability to message about, as a community, do your part, right? And I feel like, how did we miss this somewhere? The COVID seems like it's been going on for so long. How are people missing the message of, if I have COVID, that means all the people I'm with need to not be present in their workplace or in their, is there something that we could be doing better as a community group to really, take ownership, as you were saying, Dr. Zink? Is there messaging that we can get out in a clearer fashion from contact tracers, maybe not having to do such hard work when they're calling and basically having to, drill it into people's heads? No, this means no, you must do this. Please do this, over and over again. So maybe if we could just talk briefly about that, ways municipalities can help with that messaging, maybe what you're seeing, Leslie, from contact tracing side of things, and ways that we can help build that message as a community.
Yeah, thanks for that, Justin. We talked about that this morning at our OEM meeting, and I've been pondering that all day. So thanks for bringing that up again. Early on in this pandemic, contact tracers were able to contact everybody. We contacted all of the cases and told them to isolate, and then we contacted all of their contacts and told them to quarantine for 14 days. We were available for questions. People loved hearing from us. It was a fun job, and we really got the message out. Now that we're being kind of bowled over by this increased number of cases, we are, as a state, onboarding more and more contact tracers, but it's difficult to keep up. It's difficult to talk to everybody. But that's the Cadillac version, is if we could talk with everybody and educate everybody from the contact tracer standpoint. Now, certainly, our office, I'm sure you as well, we're taking a lot of calls all day long with people asking us questions and telling us that they've heard, different information and they're not sure. I take calls all day long and getting people redirected. I don't know the best way to get that information out. Again, like Dr. Zink said, the state does have a PIO officer. We try to get messages out that way. I read stuff in the newspaper all day long. I see it in the news in the morning. So I'm open to any innovative ideas, and I was excited about this meeting because I was hoping maybe the mayor or maybe some of the people on the council had some creative ideas of how we can get that information out. Thank you for bringing that up.
And then I would add, there's a couple of things, Lizzie. I appreciate your perspective, and I hear that across the state. There is a testing sheet to download. We're always trying to push that out. So, what to do when you get tested, what to happen when you isolate and quarantine. I think it's important to acknowledge just how hard quarantine is. There's a lot of reasons why people are angry, and they're like, I'm gonna lose my job, or like my kids, I can't have them at home. I've got to be doing this, or this. Like, there's real reasons for real pushback, and we totally get that. We are working with all the other states and pushing to be like, is there any way to test a shorter period out of quarantine? Like, is there any way to do a shorter period? We are pushing those conversations federally to say, help us understand the data. People are following this not because they want to be mean or don't want to listen, because it's impossible. It's impossible to do their job or to, keep a roof over their head and to do a 14-day quarantine, particularly if it happens again and again, right? Like, you're on your third or fourth, or you got small kids that you can't quarantine from, and it's a 24-day. I mean, we had one family that was like 5 weeks. I mean, it's just like, it's not tenable, right? And so we are trying as hard as we can to use the data and science to be able to make that more tenable. We don't have that yet. We do consistently see that when both people are masked, even if they've got that exposure, it's a lower risk exposure, and that testing will probably play the role moving forward. So we're trying to move easier in that direction. 2, we're working with the Mat-Su community right now. They, again, have schools in place, but they're really struggling to keep them open because they're just having so many teachers who are getting infected and sick. Like, they just closed down through Thanksgiving because they're like, we can't. And they, like the public health nurses, get the same, like 98% of the questions are the same thing over and over again. This is really relevant to you the moment it means you can't go to quarantine or you can't do X, Y, or Z. It was kind of a nice something on the news over there beforehand, but when it's you, it's different. And so we are going to start basically a COVID expert or COVID questions call line in the Mat-Su area. Other communities have that, but that would be something to consider for your area, where you got a bunch of, we could help set up training. It's the same questions, and kind of to Dave's point earlier, like, how can we help and get these young people that need something to do and others to help with that process, to help answer those questions. I think if we do more of that direct one-on-one education, it will take a lot of the pressure off of the contact tracers, off the school nurses, off of the businesses, so that they can mitigate in schools, so they can mitigate in other ways. And I think if we can do that more now, then we can have more things open and have those questions answered more quickly and have a better understanding. I think we're doing everything we can from saturating the market. I mean, there was an election that made it really hard to get stuff out, but now the election's gone. We're like trying to get more stuff out because there's more space in the airwaves to get stuff out. But I think that there's a real role for communities in here, and happy to partner with you guys to talk more about what that looks like. Or, as Leslie mentioned, any other ideas that you guys have that make sense for your community to be able to get the messaging out.
Ms. Parker, Lisa.
Thank you, Mayor Whitney. So you're talking about messaging, and had a conversation earlier this week then, and it was Justin who brought it up originally at a council meeting last week, that we need to focus more on messaging. And so in a note I sent to the city manager, I said, we need to do the messaging, and we kind of need to treat this like a campaign. And the campaign is to get people to act responsibly, and, using social media, using radio, using newspaper, everything that we have at our fingertips to get the messages out. And as we have this discussion as a council, I hope that this is something that we can focus on, is doing the messaging and getting the information out. We've got 34 schools that are closed on the peninsula right now. All of them in the Central Peninsula are closed, and probably will be closed for quite a while. I'm looking at the numbers and the infection rates that we have here on the Central Peninsula. So it's important for us to try to help bring the curve down. And I don't know if your PIO folks would work with us to help us if the council decided to do something like that.
100%. We'll work with you in any way that is meaningful to you. I mean, the YK, when they really started to have a spike, they were like, can we meet? We had a whole series of communication messaging just with the YK. And they were like, it would be helpful if we had tribal leaders doing a town hall with our local health leaders and you. And we're like, okay, so we're doing that. Radio was a big thing for them. So we're like, we filmed a bunch of radio things. They're like, we want this, this, and this in a Facebook message. So we recorded that and we sent that out. We met with Fairbanks. Communication was the same thing. And they were like, we're a community and we're better than Anchorage. And that's our message. And I was like, okay, let's do that. So they were like, what, they were like, we want to be better than Anchorage's numbers. And that's what we're going to go for. I'm like, go for it. Like, be better. Like, what that looks like. But I think every little community's got a different thing, but we are happy to partner with you in any way possible. We send out like all of this stuff, but a lot of the ideas we get are from you all too. Like when we were early on saying like, what's the limitation on masks? PIOs were like, we don't have masks to give out. So we asked the federal government, they gave us 1 million masks that week. And I was like, well, there you go. And so they went and distributed a bunch of them. Like we get, when we get ideas from you, we're happy to action anything and everything we can to support you along that. But it's really helpful to know what you think is going to work locally. You guys are the elected representatives of your community. You know your community in a way that we never will. And we are here to support you.
I'll just say thank you.
Great.
That's wonderful.
Any other questions? Thank you, Dr. Zink, for your time, and it's been very informative, and appreciate it very much. Dr. Cutchins, do you have anything you can add and help us out here?
The only thing I would add is I really want to encourage the echoes. A lot of the topics that we talked about today are talked about weekly and discussed. These echoes are big interactive sessions where there's usually a case presentation of something relevant, followed by question and answer sessions for the experts. There's a vaccine echo that occurs every Thursday. I'll go down the list here. There's a healthcare provider one, there's a media one, there's a schooling one, there's an early child development one, school health, palliative care, contact tracers, emergency medicine, vaccine, dental, local government, group gatherings, and faith communities. So the easiest way to find that is just, internet search UAA COVID Echo, it's ECHO, and just really I encourage all of you to to listen into those whenever you can, and you can sign up for any of them. It's really easy.
We are working on echoing the echo. So we are working on ways to kind of make even social media posts or summaries of what was said, knowing that everyone's got really limited time. So we can get that out. So you can be like, oh, that was a topic I really wanted, because we know not everyone can come to all of these and to be at the different meetings. And then we've started new echoes when they've been needed. We did a whole bunch of fishing ones, when the fishing season first started up. We have this rural echo. So if there's a topic that you feel like this would really help us, like this, what do we do here or there? We can either figure out, do we already have something that we could morph into that, or can we make something new to be able to respond? So the echoes come and go a little bit to be dynamic to the state and have the right people there.
Thank you. Ms. Phelps, do you have anything you can add?
I just wanted to touch again on, and we touched on it a little bit, Dr. Zink talked about it, but I know one thing that I've heard in the community when I think about that question earlier from Stephanie is, what are we seeing? We do occasionally hear about people, like the chickenpox parties, doing COVID parties, and we've heard about some of that happening here on the Kenai Peninsula. I think some people, again, misinformation, feel like they can get herd immunity by having the disease. I know, Dr. Zink, you touched on that a little bit, but I wonder if you could kind of reinforce some thinking about that.
Yeah, no, I mean, man, I wish we had, something that we could get herd immunity to by being exposed, and most people would be okay. But as I mentioned previously, we have the risk of reinfection, and the reinfection's real. So we know that doesn't last. Two, there's many diseases around the world that we've had that we never got herd immunity to. Mm-hmm. Smallpox, polio, diseases that circulated the world and just caused a lot of death and illness. We have other diseases like polio, where 95% of people were asymptomatic. And then it wasn't until it had spread enough and we started to get a lot of kids sick, and then they needed iron lungs, that we started to see it. Also polio, we had post-polio syndrome that started to show up in even people who didn't have polio-like symptoms. So we don't know how long this disease, like with the long-term effects of it as well. And we're seeing more and more of the long-term effects for it. So to me, having, a COVID party is a little bit like playing Russian roulette. Like, you might be fine, but you could have long-term sequelae from this disease, and you could get very, very ill at any age. And I don't think it's doing anything to build us to herd immunity, because we know that immunity wanes quickly. And it's just making you and your loved ones at risk for getting quite sick.
Thank you.
Thank you. Is there Dr. McLaughlin on the line?
don't think he ended up making it. He and I were tag teaming between different things, so I'll apologize for him, but sometimes we divide and conquer, and he was trying to take care of a contact tracing issue, so sorry.
Okay, thank you.
You know, the last thing I think I'll add in terms of the herd immunity is, let alone we're learning a lot more about this virus. It is different, but structurally it has a lot of things in common with the viruses that cause the common cold. You know, we've never had herd immunity to that. And if you look at even some of the data out of our Scandinavian countries, you know, Sweden tried to go down the herd immunity route and it didn't work well. You know, they had roughly 10 times the deaths and hospitalizations that Norway and Finland had in their neighboring countries. And then if you look at some of the more recent data out of there, their antibody titers at a population level are no higher. So it will discourage the herd immunity for kind of those reasons. And I just encourage if anyone's really, you know, kind of look at the data out of Scandinavia. I think that's probably where the best data from the world that we have on, you know, the possibility of herd immunity.
Just one last question, Dr. Cutchins. How long, if you have the COVID test, how long before you should receive the results of that test?
So, I mean, that's a good question. So part of it is, you know, the rapid tests, you know, they are 30 minutes. Again, only one person at a time. So, you know, we got 30 some people on this call, you know, if all of us wanted to get tested on a rapid test, the last person, it would take them 10 hours. First person would have it in 30 minutes. You know, for a send out, you know, a lot of it is shipment and travel logistics. You know, like Dr. Zink said, we do have a commercial lab in Anchorage now. So even from Soldotna, it'd have to get here. You know, a lot of our tests are getting sent out of state. I guess the short version is, and I think it's also important to remember that a lot of tests have to get rerun. So to answer your question, I mean, our state lab has pretty consistently had a less than 3-day turnaround time. That's from the time they receive the sample to the time they can get results. A day is about as fast as that can ever possibly happen at a high commercial lab. You know, most of our send outs, it really depends on shipping. You know, you can, like, for example, the Anchorage Airport, we're sending to a lab in Southern California. If you get tested on a Monday morning, you'll probably have your results by Tuesday night because you'd hit the shipping just right and they have quick turnaround. If you get tested Saturday at noon, the shipping isn't as great, so it isn't going to reach the lab until Monday, and you probably won't have your results till Tuesday. Also, as we see, you know, spikes in cases around the country, commercial labs get strapped. Reagents get shortage, but for the vast majority of the time, you know, about 3 days is how long it takes to get your results.
Unfortunately, I waited 11 days, but that was back in July.
Well, I was also gonna mention, you know, outliers. So the other thing is, you know, roughly 1 to 5% of people who get tested, it has to be re-amplified and re-extracted. So, you know, if you're on the unlucky end of that and you're that 1 to 5%, it takes twice as long. You know, in the process, it takes an extra couple days, and, you know, 11 days, I mean, I'm really sorry to hear that, but I mean, that's an outlier way more than the norm. You know, the vast majority of people are getting results in about 3 days.
I'd also just add, we see a lot of technology on the forefront here. I expect more and more. You can now have, there's 6 different companies where you can order online and do an at-home test, and you put it in the mail. It just needs, again, that FedEx to a lab that does it. And the first FDA-approved home test where it can be run at home has just improved. It's not available yet in the commercial market, but I suspect a lot more movement along that. And then, as Coleman mentioned, 3 to 5 days is our standard. If it's longer than that, call the testing site because something may have happened to it. Either it needs to be rerun or check your spam folder because an impressive number of samples go, people aren't expecting that result, and so it goes to someone's spam folder.
Thank you. There are any final questions from council? Seeing none, then I guess people can have a nice evening, what's left of it. Saying that it's almost 6 o'clock.
Right, thank you.
Thank you.
Thank you.
We appreciate the time. You guys take care. We really appreciate your leadership down there. Have a good day.
Thank you very much. On the work session here at the City Council, does anyone want to continue on discussion, or do you wish to wait until a later time? Vice Mayor Parker?
In addition to what I brought up with respect to messaging, couple of other areas I'd like to see potentially the city explore with the concurrence of the council is, as Dr. Zink mentioned, outdoor hockey rinks. And I know city manager and the Parks and Rec director are exploring that. The other thought that I had, and I want to focus on getting outdoor activities. Usually in February, we have the Peninsula Winter Games, and there's a lot of activities for kids that are outside associated with Peninsula Winter Games. Maybe we can bring those up now and get those activities going on now for kids, so that there's things to engage kids in that are outside activities. And those are the areas I would like to see us focusing on, is getting outdoor activities so that people are outside doing things, and then work with the state on getting messaging done so that we can at least provide the information. We're providing the information through every single media avenue possible.
Any other comments? And I agree with you, Ms. Parker, especially for the younger kids and the teenagers, high school kids need to get out and be able to do something. I know the city manager was looking at the sports center again and reevaluating that. So hopefully we'll see some changes possibly in the near future. But we are living in a tough time right now. And these cases keep going up and up and up, and we need to get more information out there. We need to educate the people that we do need to wear masks. We need to do social distancing and everything that we possibly can to stop the spread. We're into the hard months right now, wintertime, a lot of indoor activities that may not be able to take place. Ms. Pamela Parker.
Thank you. I, again, would just like to echo previous comments I've made about us needing to do more. I don't think that just continuing to put out messaging that people should be wearing masks is effective. I think we need to have some real conversations about what we're going to do to prevent the spread in our community. And I think that's going to involve masks in public spaces, businesses, library, sports center. I'm fine with those things being open. I think that there need to be requirements for masks when entering all of the enclosed spaces that Dr. Zink was talking about being major spreaders of this virus. Social distancing requirements, limiting number of groups that can, or number of people in groups that can gather, considering that's how this continues to spread. I mean, we can sit here all day and ask people nicely to do these things, and we can see where that's getting us now, with more cases each and every day in our town, in our neighboring towns, and across the borough. And I just think we need to do something. And unfortunately, the folks at the higher levels of government are still not doing anything to help mitigate this risk. And it's falling to our small businesses. Like Mr. Carey said, he spoke with Craig from Ali Escatire. I spoke with him earlier as well. He's having folks coming in there and forcibly placing themselves in front of his door so that they cannot leave because they refuse to wear a mask in a store. So that is something that our community members are now having to deal with on a personal level, because our government is too afraid to stand up and say, we know what we need to do to protect the health and safety of our community, but we're not going to do it. We're just going to ask you nicely to please do this on your own. And I'm fed up with that. I think that we need to take our stand and say that we are going to do something. And I think that something is going to be a specific plan in place that talks about wearing masks when you're in a public space, an enclosed public space, talks about the size of gatherings, talks about different ways to safely enjoy a restaurant or safely continue to go to the gym. I think we need to have some of these requirements in place. And I'd like to see us do something about it instead of just continuing to talk about what we nicely need to ask everyone to do.
Mr. Ruffridge?
Thank you, Mr. Mayor. That was really helpful series of questions and answers. I felt like there was a number of takeaways from me from that conversation. I think one of the bigger things that I heard was consistently the message of we know our community. We're the elected officials for the city of Soldotna, and others in our central peninsula are leaders as well. And I think some of them joined as listeners on this meeting. And I was happy to see those individuals joining in, because I think one of the bigger things that we heard, and I think Lisa was speaking to that, is the issue of messaging. And I think to Pam's point, I think messaging, maybe has gotten old for some people. It's been the same tired, wear your mask, socially distance, and wash your hands. And for the most part, I think people are attempting to do that. What we heard Dr. Zink say is people are spreading disease when they feel most comfortable in their homes, in their break rooms, when they are finding time to let their guard down a little bit. And I think some of our messaging that we would really be helpful to promote, if we were able to work with the state on whatever level, to get out the message that we have to be in this together. We must stop bickering and deciding who's right and who's wrong about whether to wear a mask or whether to do such and such or to limit our businesses. The truth is we have to find a way to live in the times of COVID. We have to. And there's so many tools that we have that we can use to promote that life, whether that's outdoor activities, whether that's testing and quarantining, and everybody knowing what their part is that they have to play in order to do those things, whether that's masking, whether that's social distancing, whether that's voluntarily limiting the amount of people that's within your business, whether that's the city taking ownership of limiting library hours or limiting indoor activities at the sports center and limiting access to City Hall. I think that there is a wide and nuanced amount of things that we are capable of doing as a community. And I heard over and over and over and over again is that it's going to take all of us. If we as a council make a decision to mandate something, that's taking away the responsibility of our community to join us in fighting this disease together. And if we take that away, ultimately, I fear that what we're going to get is a response in equal kind. You can't tell me what to do. And I'm worried about that. I would rather us attempt to have the messaging be, we cannot win this battle without all of us taking it seriously. And here are the ways that we can do this. And it might not need to be the rehashed, wear your mask, wash your hands, and socially distance. It might need to be, did you know these things about quarantining? Please don't come to our town if you just got off an airplane and attend a party, right? Please don't have a baby shower with 700 people present. Maybe you should postpone your wedding until March. There should be things that we're messaging people to say it's important. It's gonna take all of us. And if we just focus on one specific thing of mandates, I fear that the messaging will actually be lost. And we won't be able to gain that public trust back again. They will just say, you are just one of the same groups of people that we've heard since the beginning telling me what to do. And I think we need to literally beg our community to join us in fighting this thing together. It cannot be just the hospital slogging it out. It can't be Dr. Zink on 17 different Zoom calls every hour trying to keep up. It can't be just those people that we're looking up to and saying, you fix it. And government can't be that either. It has to be the whole community, and we have to ask for it. And we haven't done that yet. We haven't asked, please join us. And then given reasonable ways for people to do so. And so I am full support of what Lisa's talking about. I would say an onslaught of positive ways that we can help each other beat at least this moment in time and try to get back to a little semblance of order and life.
Thank you. Ms. Queen, you had your hand up.
Thank you, Mr. Mayor. I raised it just so I could give you a quick update on a couple things we're working on. The council got an email, I think it was last week, from a business owner who suggested that we could procure a large amount of masks and then offer them up to local businesses. And John has been doing that work. He's reaching out personally to businesses. And so far, he started with 10,000 masks. He doesn't think we're gonna have any problem getting those out because the response has been really positive from the business owners that he's reached out to so far. So I wanted to let you know that we've moved forward on that already. John's making those contacts, just making those available if they wanna have them at their front counter for patrons. I'm meeting tomorrow with Andrew Carmichael and Joel Todd, and we're going to talk about not only the sports center, but outdoor activities as well. The ice is getting nearly thick enough at Arc Lake. They were going to go put some equipment on it recently. We normally flood the path at the park. We're going to come up with a plan to do that. We're even reaching out to the school district. There's some empty outdoor hockey rinks, and it may be that they allow us to take over maintenance and put some ice in those rinks as well. So we're excited to think about and brainstorm, implement lots of those types of activities. We do recreation really well year round, and no doubt those guys will come up with some really creative ideas that we can then help advertise, let the community know about. So just wanted to give that update. Thanks, Mr. Mayor.
Thank you. Are there any other comments? Seeing none, go ahead, Vice Mayor Parker.
Okay, so there was an interesting article this morning, and I forwarded this to Justin. So last night in Utqiagvik, the city council included a unique punishment for rule breakers of the COVID restrictions that they have in place. And they are now requiring that if you break their rules in Utqiagvik, the first recognition is some residents aren't educated in that you have to make a PSA and take that into voice recording that will be radio, video clips, and also become a flyer. So based on what Pamela said, as we look at messaging, while Alyeska is not in the city limits, we all use Alyeska, a lot of us use Alyeska Tire, maybe reaching out and getting those businesses that are being impacted by people who aren't wearing masks to also come and participate in the messaging and how it's important to them to protect their workers, to protect their families, to protect our hospital, our CES personnel, and to get our kids back in school. We need to focus on the whole community. It's not about me, it's about the community. That's all.
Thank you. Any other comments? Yeah, seeing none, if there's no objections, we'll call the work session to an end at 6:01 p.m. Thank you.